Ivy League Pharmacy provides home infusion and home health services to patients in their homes or in infusion centers. Our service starts with evaluation of the patient needs. In some cases, we receive this information through fax or email from hospital case managers. In other instances, our clinical liaison visits the patient in the hospital prior to discharge.
Good morning, Mrs. Thompson. This is Debbie. She's a nurse liaison from Ivy League.
Nice to meet
Thank you.
They will be providing you with your home health and home infusion.
Here, our clinical liaison is coordinating with the hospital case manager and introducing our services to a patient and her caregiver in the hospital.
You know you had your PICC line put in a few days ago, and
Yes.
the antibiotics are going okay here at the hospital, right?
Yes, yes.
Well, we're just going to come to the house and make sure that they continue to go just fine. You're going to have a pump at home, and the nurse is going to come and teach you how to use it and teach you how to flush your line and, you know, just help you really live with the whole antibiotic therapy because you're going to be on it for a few weeks, right?
Right, that's what I've been told.
Right. So when are you going to go home?
Well, I was told we might go home today.
Okay, so the nurse will come to your house this afternoon, and the pharmacy will deliver the medications for you. She'll teach you how to do your vancomycin morning and evening, just like you've had at the hospital.
And the nurse will come how often?
She's going to come probably 2 or 3 visits daily until you're fully comfortable in using your PICC line, flushing it, and doing your antibiotics.
So this is something I have to do myself?
Yes, yes, you and your family will be taught how to use the medication and the pump and the PICC at your home.
Is this something the doctor ordered?
Your doctor has ordered this for 4 weeks for you at your house, and then he would like to see you in 1 week to follow up with you to check your leg.
If I needed to take a shower, how would I do that?
You will just wrap it up with some saran wrap and then secure it at each end, and then you can shower. But the nurse will come and change the dressing every week, and so you can just cover it up when you're going to shower.
Now, is this covered by my insurance?
The home care, yes, yes, your insurance will pay for it, and then usually the patient has a copay, just like when you go to your pharmacy and pick up medications.
Well, how much is that copay, or how would I know?
I can have the billing people call you and talk with you. I'm really not sure what the copay is at this time.
Okay. And when can I go home?
You'll be able to go home today in about 2 hours.
Okay.
And then the medication will be delivered after that to your home, and then the nurse will come this afternoon or this evening.
Okay.
Great.
I think it's something I'd like to try.
Do you have any other questions?
I don't think so. I'm ready to go home.
Okay, let's get you home.
Thank you, ladies. Thank you. Thank you.
Okay.
I think this is going to work out fine.
All right.
Every intake starts with a phone call to our office. All calls are answered by a live person, as we do not use automated phone trees. We are available 6 days a week. After hours, our intake, pharmacy, and clinical liaisons are just a phone call away through our toll-free line. When you call us, your call is transferred to a dedicated, experienced intake coordinator.
Hi, I'm Frances, intake coordinator at Ivy League. In my department, we receive patient information from hospital case managers and liaisons. We verify patient coverage and eligibility and communicate that information with the case managers and the patient. We gather information such as what type of access does the patient have? Is it the first dose? Is the patient trainable, or is there a competent caregiver? We process all this information and pass it on to one of our contracted agencies. We work with over 100 licensed agencies, so staffing is rarely a problem. Our guideline is to have the medication to the patient's residence within 4 hours of receiving the final order. Even in extreme cases where a patient lives in a remote area, we can always offer to send a nurse to the hospital prior to discharge to hook up the patient in their room. Then we'll follow up with the assigned nursing agency the following day.
Here is an example of a referral being called to our office.
Thank you for calling Ivy League. How may I help you? Yes, let me transfer your call.
Hi, you've reached Frances in the intake department. Hi, thank you for sending the referral. And when is the patient going home? And what type of line do they have? Is this their first dose? Do you have nursing arranged, or would you like me to take care of that? Okay, well, we're going to verify their insurance, and then we'll give you a call back as well as the patient. and let them know what they've met or if they have any copays. All right, thank you so much. Bye-bye.
Hi, this is Ola. I'm calling from Ivy League Pharmacy. I'm trying to check benefits and eligibility for patient Sherman Vicky. Patient's policy number is BBSPO4581. The effective date, 7/1/2010. What's the patient's 2011 deductible? And how much of that has been met? What about the patient's coinsurance? How much of that has been met? Is home infusion covered under the patient's benefit? Is pre-certification required? Can I get a reference number? 56724. And your name again was? Monique. Thank you very much, Monique. Bye-bye.
Once the eligibility and coverage is verified, the intake is rushed to the pharmacy for order processing. Meanwhile, the patient is contacted and informed about the delivery time and financial responsibility. The nursing agency is contacted and the start of care is coordinated. In pharmacy, the patient's clinical condition is reviewed and the medication is checked by an experienced IV pharmacist. The pharmacist will call the physician for any order clarification or dose adjustment. The IV medication is prepared under sterile conditions and the necessary IV supplies are packed. If an infusion pump is used, the pharmacist programs and verifies the pump. Our pharmacists also keep constant communication with the ordering physician by generating customized reports that inform the physician regarding the progress of therapy for their patients. Meanwhile, the dispatch department is busy routing the patient delivery, making sure that the medication will get there on time. Ivy League's delivery personnel deliver the medication to the patient home and advise the patient regarding proper storage for the medication. Home health nursing can be arranged by Ivy League intake coordinators. The home health nurse will call the patient to inform them about the visit. Upon arrival, the nurse will evaluate the patient and prepare a report for the physician. The nurse will then double-check the physician order and the medication label and prepares the patient for the infusion. Ivy League has chemo-certified and PICC-certified nurses under contract and can arrange to perform these specialized services at the patient's home. Lab draws are a critical part of providing care in a home setting. Ivy League has developed special tools to track performing lab draws and check lab results. The nurse will also do the lab draws as ordered by the physician and delivers the sample to an accredited clinical laboratory. Ivy League pharmacists shall review the results and inform the physician regarding any abnormal results. Patient training is an integral part of our home health nursing partners. Our nurses will strive to make patients and the caregiver independent, and pharmacy will follow up with all of its continuing patients to make sure that the therapy is going smoothly and the patient is satisfied with the services. In the past 17 years, we have assisted over 50,000 patients, improving their quality of life by allowing them to stay home while receiving the same level of pharmaceutical care that is available in a hospital setting. We stay committed to being a provider of innovative solutions for today's IV needs.